live? Yes, perfect. All right. So good evening, everyone, and welcome to CMMP and Medscape's Bridging the Gap, Advancing Diversity in the Field of Dermatology. I first want to thank AbbVie for their educational grant to allow us to put on this workshop tonight, or this webinar tonight. So I want to first introduce our lovely panelists. We have Dr. Alexis Carrington and Dr. Sarah Hogan. So if you all don't mind just briefly introducing yourself for the rest of our lovely audience, that would be great. Dr. Carrington, you want to go first?
Definitely. Hi, everyone. My name is Alexis Carrington. I'm a board certified dermatologist. I'm currently completing my ASDS Cosmetics Fellowship out in Houston at Derm and Laser Surgery Center. I'm born and raised in Sacramento, 916. Also affiliated with UT Health Houston. So thankful to be on this panel and looking forward to this discussion.
Thank you, Dr. Carrington. Dr. Hogan?
Yeah, I'm Sarah Hogan. I'm a board certified dermatologist. I own a private practice in Washington, D.C. I'm also faculty at George Washington School of Medicine and Health Sciences, and thank you for having me.
Absolutely. And I'm Dr. Lauren Payne, another board certified dermatologist. I also have a private practice in New Orleans, Louisiana, also faculty at GW and chairperson to the board of directors of CMMP. So the purpose of this webinar is to really honestly address what the topic talks about, the lack of diversity in the field of dermatology. So I wanted to first dive in with just a couple of little stats so we can see where we are. These are two graphs of racial distribution of dermatologists from 2007 to 2018. And as you can see on the graph on the left, it's racial distribution of academic dermatologists. And as you can see, the kind of lower bars in terms of the red bar, which represents Black academic dermatologists, as well as the yellow bar, which is they're kind of overlapping each other. Or sorry, the green bar, which is kind of overlapping the red bar, which represents the Black and Hispanic community, are at the kind of lowest in terms of number of academic dermatologist representation. And then we move to the right, which shows the racial distribution of dermatologists by academic rank. And again, very low diversity, very low representation among the Black and Hispanic population. Next slide, please. And then we'll move on to a breakdown of dermatologists by race and ethnicity. So these are a little bit more recent statistics. So the graph on the left shows all specialties breakdown by physician ethnicity. And as you can see, if we're looking kind of more at the minorities in medicine groups, including the Blacks or African Americans, which are the purple, and the Hispanics, which are the pink, you can see they represent 5.2 and 6.3% of all physicians, respectively, in the United States as of 2022. And if you look more specifically at the field of dermatology and representation amongst all groups, you can see that the Black or African American community that represents about 3.6% of all dermatologists in the United States, and the Hispanic community represents about 4.7%. So as you can see, those don't represent the actual overall representation of those groups in the nationwide population. So there clearly is a lack of diversity in the field of dermatology, which is why we are having this conversation tonight. So I want to kind of just dive in. We're going to kind of talk about a little bit about our paths very quickly, and then we're going to have some questions for the panelists to go over kind of the need for having diversity in dermatology. So Dr. Carrington, can you give us maybe a 2-minute spiel in terms of your path into dermatology?
Definitely. So very briefly, like I said, from California. I'm not going to lie, medicine wasn't on my radar when I was considering careers. I did acting beforehand and decided around high school is when I was like, okay, I'm interested in medicine, and kept an open mind in terms of specialties. Was considering OB. Dermatology was interesting, but I wanted to see what was out there. And I went to a medical school in the Caribbean. I went to St. George's in Grenada, where I did my first 2 years of med school there, and my last 2 years in New York, and then ended up doing my intern year there and residency at GW. And the other thing about me is I did not match into dermatology my first time. I matched during my second time, and we'll get into this further into our discussion, but there are definitely different barriers that make dermatology competitive, ranging from USMLE scores, also ranging from accessibility to rotations, the costs, all of those things. And that was definitely some barriers that I experienced myself. Thankfully, I was able to ultimately match, but it was definitely a winding road with some of these barriers that we'll discuss.
Thank you. Dr. Hogan, would you like to tell us your path into dermatology?
Sure. Medicine is my second career. I attended graduate school. I have a master's degree in public health policy, and I worked doing health services research as a public health policy analyst for a few years. Then I attended medical school in Chicago at Loyola. And I actually, because I had a public health background, thought I was going to be a primary care doctor. But one of my primary care physician mentors said, I think you might like dermatology. You really like procedures, and steered me towards one of the mentorship programs that we're going to talk about tonight. I ended up matching my first time. I went to a categorical program, so both internship and dermatology residency were at the Cleveland Clinic, and then completed a cosmetic fellowship like Dr. Carrington is now.
Thank you. Thank you. My path, I knew I wanted to do dermatology since high school. I was kind of the weird kid. But I actually didn't match into dermatology. I actually matched into neurology, and then was able to change into dermatology, which is what fate had in the cards for me all along. Was not an easy path, which we'll once again discuss, but it's worth doing if that's really what you want to do. So before we kind of dive into barriers, I want Dr. Carrington and Dr. Hogan to give us your view on the stats that we showed in terms of a lack of diversity amongst academic, physicians, and then specifically in the field of dermatology. How can you see that being a potential concern or issue in terms of, patients' accessibility and comfortability with dermatologic care? Whoever wants to go.
Yeah, okay. Um, that so the first slide, the data is a little bit old. It would be interesting to see how much it changed, if it's changed. But my first job out of fellowship, I was academic. I was at UCLA, and I was the only full-time Black faculty there. I think mentors matter. I think back to my own experience, and had I not had the wonderful mentors I had that were willing to call programs after I interviewed or tell me who else to work with or ask about doing research with, I think it would have greatly affected my ability. And so, on one end, getting in, mentors matter, and having some kind of representation matters. The second piece is when you are in your training, having that kind of lens. So, you know, if Black dermatologists are only 3% and we're only 1% of all physicians are dermatologists, only a couple hundred people in the country. And so not everyone is going to have access to a Black dermatologist. So I tell patients, or when people, send me messages and ask, then look at where that person trained. Because if it's an academic program that's oriented to not just creating a strong dermatologist, but having training in diagnosing skin of color, disease and skin color, treating skin of color, right? Then at least you're going to be able to have someone who has experience with your skin.
I was just going to add to what Dr. Hogan says, and I'm really glad that we are having this platform and also discussing the stats. I would say a picture is worth 1,000 words, and those speak volumes. Like, those numbers are abysmal. And in our population, which is becoming more diverse every year, it is sad to see how it is not reflected in the providers that we have. And I know that it affects patients and their trust in whether their physician provider can diagnose their condition properly or treat it properly. The amount of times patient come in and be like, who tell me you're the first Black dermatologist that I have seen. I heard that in residency. I hear that now, and I know I'm not the only one. So we definitely see, and this is a good reflection with the stats that we see, how important this is in providing culturally competent as well as accurate and scientifically backed care, and having it in a wide, diverse population.
Yeah, like that you said, culturally competent. I think that's a big deal, and what a lot of I think maybe lacking is the cultural competency. If we don't have the representation amongst dermatologists for those minority communities, at least that we have a cultural competency of the majority, that would be helpful as well. So we are. It seems like there are programs that are working more on that, as Dr. Hogan mentioned. Having programs that are a little bit more inclusive and a little bit more well-rounded in terms of being able to evaluate and identify different skin types on different skin tones. I think that's become a little bit more of an importance in a lot of dermatology residency programs. I think that's a good thing, but of course we obviously still have a long way to go. So one day at a time. Okay, I want to dive into a couple other questions. So let's say Dr. Hogan. So for a student who's dermatology, what would you recommend for them as far as starting early in their, getting their pre-med and early med students, getting their kind of foot in the door or getting themselves prepared to potentially, enter in the field of dermatology down the line? What recommendations do you have? Let's start with, as a pre-med, what would you recommend for pre-meds?
Pre-med,
It may
be
have
a well-rounded. No, for pre-med, honestly, it would be, yes, perform well and do the prerequisites, but get a degree in something you love, right? Become a whole person. Be an interesting person, because medicine will take and take and take from you, and your patients will take from you, not in a malicious or a malignant way, but they need you. And so you want to be an intact person before you go on. It was for me a 15-year journey. Other people it's 12-year, but you go on this decade plus journey. So that would be my advice for pre-med. For a medical student, there should be no excuse in terms of your performance. So throw yourself into everything. When it comes to your clinical rotations, the way I approached it, maybe it was right or maybe not, but I felt like this was my only time I was going to be able to deliver a baby, or this was the only time I was going to be able to really learn milestones for children. And I threw myself into all the rotations, knowing that dermatology was something I wanted to do. And those things all add to your dimensions of being a, well-rounded physician. But you also have to do the work. And when you ask people to vouch for you, your scores need to be a certain way, or your performance needs to be a certain way. Those are my.
These are all great points, Dr. Carrington.
I'm so glad you said major in something you're interested in, because that was something I wish that I heard when I was in college, because you can major in something like Spanish. It doesn't have to be bio, chem, or what have you. And it makes you a much more interesting person and physician. So yes, keep an open mind, pre-med and even med students as well, because there's so many things out there. Dermatology is not the end all be all. Obviously, we love it. But there's so much that you can do, and you just don't know unless you get the exposure. A thing that I recommend for my mentees in medicine and pre-med, I just say shoot your shot. Reach out to your local dermatologist, reach out to whatever like person that you're like, ooh, they are doing something interesting. Just reach out via email, or if you see them in person, obviously read the room, but just you can go up and approach and be like, hey, I am in this position. I'm considering this. Could I shadow you or what have you? Obviously be respectful, but the squeaky wheel gets the oil. So keeping an open mind and then just seeing different things. Obviously scores, very important, but also just vouching for yourself and shooting your shot. You never know where it can get you.
Absolutely. Yeah. And I'll definitely co-sign on, choosing something that you love in undergrad, making sure that if pre-med is what you want to do, you are, hitting those prerequisite courses. So I think most schools have, pre-med advisors. So definitely make sure that if you do choose a major that's not, the classic bio, and you're interested in pre-med, taking those classes too, but also finding something that you actually enjoy is important. I think it's also important to stress that in undergrad, it's not necessarily dire that you need to be in the field of dermatology or you need to have exposure to dermatology. There will be, plenty of opportunities down the line to do that. I think undergrad is kind of just preparing you for getting into medical school. That's the first hurdle, right? Dermatology is years down the line. So I think just trying to make sure that you're in the best possible position to get into med school should be your number one priority. And I like the idea of seeing a little bit of everything, because I think, sometimes people have a different view of what dermatology is. They see social media, and they think it's all glitz and glam and Botox and filler. We're all physicians, and all of us on this call, even though Dr. Carrington and Dr. Hogan have done cosmetic fellowships, they are still medical dermatologists. They are still nerdy and like medical derm sometimes, like the rest of us. So it's important to know the entire field of dermatology and what it all encompasses. And that's where Dr. Carrington mentioned getting exposed to the field, shooting your shot, trying to shadow where you can, I think is important as well. So those are all valid points and great points. Okay, so what are some of the barriers that either you've personally experienced or that you've seen in your mentees to advancing the community in the field of dermatology and dermatology as a whole?
Mentorship's one, finding mentors. That can be hard. And, sometimes people are overcommitted. And so it's, the same person is getting requests from a lot of people. So that's one thing. For me, I always think, I don't know, because financially, I didn't have family that could help me financially. And it's a little bit different now, but when we were applying, we had to go and do rotations where we would be a month somewhere else in the country as a fourth year medical student, trying to demonstrate that you were potentially going to be a great dermatology resident. And I had to take out a lot of loans to make that happen. And I was already having loans that I had taken out to apply to medical school. So I think that can be a barrier. There were some opportunities that I couldn't take advantage of because I couldn't afford them. And I think that may narrow, the you're the product of the opportunities around you. So that may, if you don't say yes to certain things or you turn certain things down, sometimes people don't ask you again. So certain programs will be like, oh, you can't come? Meh, we're not going to interview you. So I think that's an issue. And traditionally, when you look at how financially large it is to take on medical school debt for those of us that do, it can limit you. And unfortunately, certain populations tend to have backgrounds like that in terms of you look at generational wealth or resources in that way.
Oh, great points. Dr. Harrington?
Yes, mentorship, I definitely experienced that as well. Also, like coming from an international medical school abroad in the Caribbean, that's another discussion. I won't delve into it, but that's a big one with that stigma. Definitely rotations, not like the cost, just like what Dr. Hogan was saying, because that is a pretty penny in terms of the cost of room and board, flights, and everything. And even scores too, like USMLE, like when I went through it, it was step 1 and step 2. They were all numerical. Now step 2 is just numerical. And things have gotten better in terms of not putting so much weight on the scores, but definitely like for me, like I'll be honest, my scores, like I did fine, but they were not like the top. And with dermatology, USMLE scores like typically prefer like the high, the top score. So that was definitely a barrier as well. So like I said, things have gotten better, but there's just multiple facets. And I feel like I feel it compounds. So where it's not being able to get a mentor makes it harder to get a rotation, makes it harder to get research, and all of those are needed with dermatology. So I feel like those barriers can compound, kind of like a domino effect.
Absolutely. So in discussing the barriers, do you all have any suggestions as far as ways that we can either address and or start to overcome some of these barriers?
So I think it depends at the stage you're at. If you are a pre-med applying very broadly, and depending on where you get your choices for interviews, um, really trying to make sure you try to be at a place that has a home dermatology program, because that is a huge factor if there is a home program, because it's easier to find mentors, it's easier to have exposure to dermatology than as a medical student. If you're a medical student, wherever you are, going to meetings, trying to network, emailing people, reading about them, trying to connect in that way to try to find those mentors early. If you know that you want to do this, you should be trying to do something as soon as the summer between your first and second year of medical school.
Sorry, I muted myself. um, sorry, just repeat the question one more time, Dr. Payne.
Any suggestions for ways that we can kind of start to overcome or address these barriers in dermatology?
Mm-hmm. Definitely, and I know we're going to get to this slide eventually, but there are a lot of programs that can help bridge this gap. That was something that I took advantage of in order to get myself into the space. So there are a lot of organizations, including the AAD, Women's Derm Society, Skin of Color Society. Each of them have different grants or programs that are available for people of all levels, med students, residents, particularly for underrepresented people in medicine. And also attending conferences. I know they can be a bit pricey as well, but that is where everybody gathers, and that is where you can attend some events. And that's where I made a lot of my connections and going to as many conferences as I could. So I highly, and even following these organizations on Instagram or whatever social media platform, that is another way that you can connect. And that was something that was valuable to me in my journey to dermatology.
Absolutely. So I guess if the audience hasn't got anything else from this, it's that networking is of the utmost importance in the field of dermatology because it is so small. There is some element to who you know. And so, like Dr. Carrington mentioned earlier, shoot your shot. Like you have nothing to lose. It's all about just trying to get in the field, get to know who people are, and get to kind of just know about what dermatology encompasses and how you can kind of get in that space if that's what you're interested in. I like Dr. Hogan's comment too about, trying to, if you can, find a med school that has a home program. It's great when it happens. Just because your program doesn't have a home program doesn't mean that it can't happen. So I went to Morehouse School of Medicine. We didn't have a dermatology program. However, Morehouse is in Atlanta. And so Emory University is also in Atlanta, and they have an excellent dermatology program. And so I had to go outside, after hours, after school, and go and make those connections myself to Emory. But that's because I wanted to be in dermatology so bad. So it's not that if you don't have a home program, you can't get in. It's just you have to put in that extra work. And I think that's just kind of the common theme in dermatology in general. Unless you come from this pedigree of dermatologists, it's going to be a challenge, right? But nothing that if you really want something, it's worth working for. And so I think that's also a message that we need to reiterate over and over and over again, especially in dermatology, because it is one of the most competitive fields. Let's see if I have any other things. I think that's all I have as far as questions. Do you all have any final kind of take-home points that you would like to give us in terms of advice for up-and-coming dermatologists that are kind of, starting this field and starting this journey and looking for mentors and looking for kind of just general advice?
Someone told me in med school, plan your work and work your plan. And I thought that was really helpful. So taking a inventory of where you are, where you would like to be, who is at your disposal, who is in proximity, like if there's a different program in your city, or if you happen to know you're going to be somewhere, making time to make a connection with someone. And then also planning even, your courses a certain way or how you're going to study, and just really keeping your eyes on that goal because it is attainable. And then also remembering, like, to keep in perspective, I have two pre-med students that work for me right now, and I keep telling them they're interviewing, like for med school. You just need one interview, and then people just need to meet you, right? So it's the last thing, I'm sorry, is to stop comparing yourself to other people. Get off Student Doctor Network and Reddit. And that's part of plan your work and work your plan. Cut out the noise. Cut out the noise, and then just do your best.
Yes, Student Doctor Network. No, it's evil. just kind of reiterating what I was saying, like keep an open mind. You never know. That's what like college and even the med school rotations are for. You're meant to see what OB's like. You're meant to see what surgery's like, and just take it in. If you want to do dermatology for like fame, clout, money, do not do it. Or money, like there are plenty of other ways. You have to do dermatology or whatever you love because you truly cannot see yourself doing anything else. So you got to be true to yourself and not to do it for parents, spouse, friends, what have you. You got to do it for you because you will be doing the work. That's one thing. Obviously, keep an open mind. And if it is in your heart where it's like, I can't see myself doing anything else, two pieces of advice were given to me. One of my mentors said, you got to be strategic. And the other of my mentors said, you got to be a little bit scrappy with it. So all coming down to shoot your shot, like reaching out. Obviously, don't be overbearing, but there's nothing wrong with an email or approaching the person. You just truly never know. And I get it. I get nervous when I'm like, oh God, I gotta talk to somebody. But no, it's okay. Like they're human too, and they started at one place, so you will do the same thing. So, and the last thing I'll say is things do work out, and at the end of the day, you will land on your feet no matter what you do.
Absolutely. Everybody has their different path, and what your path may be something different than what you expected, but it's going to work out in the end. We just want to kind of wrap up with this slide. So make sure you take a screenshot. So these are programs and resources that are available if you're interested in dermatology, whether it be obtaining mentors, potentially finding some scholarships, comprehensive medical mentoring program. So we are a mentoring program that tries to get more minorities into all fields of medicine. We definitely have several initiatives in the field of dermatology as we're partnering with Medscape. The Dermatology Intergroup Association, Women's Derm Society has a mentorship program. The AAD has a diversity and mentorship program. I think we all were a part of that at some point in medical school. NMA Derm, Skin of Color Society, and SNMA also have great resources, as well as the Farms database. So once again, take a screenshot of this screen before it goes away, so you have access to resources. And we just want to thank everyone for joining, and we hope you enjoyed our presentation, and have a good night.